This is a demonstration of an ENT chart in HST eChart. When you sign into eChart, you'll be brought to the schedule page. As you can see, the schedule page will show all of the patients from the practice management with a few extra details. For example, the paperclip indicates there are documents attached. The dog-eared corner indicates that there are appointment notes. If there's a red dot in the dog ear, it indicates clinical notes. If you wanted to see the document attached or the notes before entering into the chart, you can tap and hold. It will open a pop-out. In that pop-out is where your front desk people will check in the patient. It is also where you could see that an H&P is attached, and the rep will be there for a new stint. eChart is designed browser-based. That means anywhere you can locate a Chrome browser, you can log into eChart. eChart is also designed for a tablet. That means whatever device you have, the system will resize itself and display accordingly based on the tablet and the position of the tablet landscape or portrait. Let's go ahead and get into the chart. To open a chart, you simply tap on the chart. eChart is designed to keep each user within their workflow so that they do not have to navigate outside of their workflow to find the information that they need to complete the documentation of their care on the patient during this visit. This page, the home page of the chart, contains several tabs. The first tab is the current visit summary. The current visit summary will complete automatically as the patient moves through the continuum of care. The second tab is the previous visit summary. If the patient has had a previous visit in HST with eChart, the date is a hyperlink to that previous visit. It will open in a new tab in the browser, and it will display for you the previous visit for the chart. It is bookmarked so that you can easily find the area of care that you want to review. It opens in a new browser window so that the user is able to review the document, yet still toggle back and not lose their navigation position within the chart. The next tab is clinical notes, and this is where you would put notes like the patient is claustrophobic. Once you save that note, it'll be there for any of your other clinical users to have information about this patient. There's also a tab where you will reconnect the specimen results with the specimen and a patient portal data where the data is pulled in directly into the chart. Let's go ahead and start with patient communication. What's important to notice is that each chart is designed on a series of blocks. These basic level of charting, these little bits of data, are stacked in whatever order your surgery center chooses to have this information so that you can chart easily by scrolling through your workflow one block at a time. Not all blocks are in every kind of chart, and not all blocks are in the same order. Your center will decide that when they complete the eChart build. The communication log is what we call a grid block. It allows you to make multiple entries until you can complete that call in the flyout. Every block has a completion indicator in the lower right corner. That green check mark tallies block by block to the completion indicator in the header. The indicator will tell each user when they have completed 100% of the required fields in their workflow. Also in the header, you'll notice that there's a place to capture the patient's image, and there are alert banners, as well as a place for patient demographic information. Any workflow in the chart can be printed, any block can be printed, and then any series of blocks combined can be printed. The other features we'll discuss as we move through this demo. The patient information comes directly from the practice management system. Any changes made in this block will also be made in the practice management. So when the patient's address is entered, that address will now be in the practice management side. Your center may also choose to create blocks of its own. We call these questionnaires. You can create a questionnaire, as this example does, for health screening. We give you the tools and the knowledge to understand how to create these blocks, edit these blocks, and design these blocks as you choose. This is just an example. The allergy block in HST has many functions, and in the back side on the database side, it is linked to the gold standard database. When an allergy comes in and is checked with the reaction and saved, behind the scenes, the system does a drug allergy check against every potential medication that can be administered during this patient's visit. It will also check when the patient's home medications are added to make sure there is no drug-drug interaction that could be possible with the drugs that potentially could be administered during the patient's stay. So the home medication and the allergy block are very important to the system. When you complete the information in a block, that information pulls forward to any other workflow that will contain the block. That is important because repetitive re-entry of data can lead to mistakes, and we want to limit that as much as possible in eChart. eChart has a unique relationship with a third-party application called DoseSpot. DoseSpot allows the users to obtain a 6-month prescription history of the patient with their permission. Once you have their permission, you'll be able to import that history from DoseSpot, and it will populate the patient's home medication grid for you to confirm with the patient what if they are still taking that medicine and when the last dose was. The information in the home medication block will also populate the medication reconciliation block. We're just going to review the medications in this block. The anesthesia history, if completed by the pre-op call nurse, the information will flow to the anesthesia workflow. All information will pass through to each other workflow as it is completed. Some blocks are longer than others, but the completion indicator in each block will always tell you what are the required fields to complete for each of these blocks. And as you complete those fields, all of the information at the bottom will disappear as you complete each field that is required and the signature. And now you have your green check and your 62%. You get to complete when the patient should be arriving at your facility and who put that information in there. And you can create your own pre-op call instructions. Again, with the way I said, you would complete any questionnaire. If you do not get 100% in the upper right corner and you tap on it, it will always tell you where you have failed to complete a required field. As you can see, we got our 100%. Let's proceed to the day of service registration workflow. In the registration workflow, you'll be able to use the image capture to take a picture of your patient in the chart. The reason we allow you to take a picture of the patient is because HST eChart allows you to have multiple patients open at the same time. And you're able to toggle between those patients by using the pin feature. The pin feature is located in the header next to the percent indicator. Once you pin a chart, it will remain at the bottom of your toolbar and allow you to toggle rapidly between patients without going back to the schedule page for navigation. This is important if you have multiple patients that you are juggling, let's say, in pre-op or post-op. And if registration is assigned several patients to you, you'll be able to click through those as well. We're going to start the registration time. This is called the Me button. It will always populate with the logged in user's name. Once you populate that field, it will automatically populate the staff block that coincides with the registration. That information, the times and the people, flow back to the practice management for staff utilization and case costing. You can see that the information from the questionnaire pre-populated into this field, and I need only confirm it with the patient and ask them if they have a COVID test and the results of that test, and if they have been vaccinated. You can then have the patient sign it, if that's how you design your chart, and have it witnessed. All of the consents, privacy and financial, are designed by your center. We use the words from your consent and populate here. As you can see, the touch screen on the tablet allows the patient to quite easily sign all of the consents. We're going to go ahead to the pre-op workflow to show you that the information that we pulled in before still pulls in for us, including the address that we changed. When information pulls into your workflow from another place, you simply need to accept it. Here's the allergies that we talked about. The allergy block requires a review anytime a user is in the chart. The NPO status is here, and then room in. This chart was designed to have several blocks before the room in block. That's because perhaps at this center, when they go out to greet the patient, they match the patient's ID with the patient information. On the walk back, perhaps they ask about allergies and the NPO status before they get to the cubicle to room in the patient. Once they've roomed in the patient locator will automatically update with this information, along with the user who is now claiming responsibility for this patient. Height, weight, BMI is an important block. As you complete it, you can do so in imperial or US, or you can do so in metric. Either way, the opposite will appear to the right. So if you put it in metric, the imperial will be to the right. The system will automatically calculate the BMI. The patient's BMI is in the header on the anesthesia row, and the patient's weight in kilograms is also in the header. And that's very important if you need to deliver emergency medications and need the patient's weight in kilograms to do that. The home medication block that we completed in that pre-op phone call is now here for the nurse to confirm when the last time they took that medicine. And we're going to say that they took that medicine this morning and check that it's okay. Physician orders are signed by the physician in their workflow. All the orders are together for them, and you only have to complete your signature for your orders. You don't have to search for them. The system will parse out the orders Pre-op gets all the pre-op orders. Each workflow gets only their orders, so you don't have to look through all the orders to find the ones that pertain to your area of care. If no one has signed the orders, the physician may change the order set on the fly. However, if anyone has signed the orders, then the orders may not be changed. Each of these orders has the ability to be a standing order if they have gone through your committee and you've designed it that way. They can be a pre-RN order, or they can just be a regular order. They can also be a verbal order. The orders will stay yellow until the provider signs them, but the nurse would sign them by selecting all and applying a signature. As soon as the orders are signed, you'll see a lock. That means that the order has been signed, and therefore, if it's a standing order, can have been carried out by the nurse. However, if you signed an order in error, you can always strike through that order, give your reason why, save it, and the order will be stricken through. Any medication orders, as you could see, had the med check done that we discussed earlier. Green check means there are no interactions. Yellow caution means there might be a caution about this drug. That doesn't mean you can't give the drug. It just means that there might be a caution. In this case, limit the dosage and duration of these drugs, as they may cause drowsiness, which is probably why we're going to give it to them. So this medication, this is now signed by the nurse, but it's still missing the provider's signature. And that brings me to the next point about HST eChart. We have in place a very important tool that will allow the users to have multiple people charting in the same exact chart at the same exact time, but it won't compromise the care. And the reason for that is a tool that we call Live Edit. And the Live Edit tool allows multiple users to chart in the exact same chart at the exact same time and share that data instantaneously with the other user. So as you can see, I am logged in on the left as the provider, and I am logged in on the right as the nurse, as we have been using it. When the physician signs the orders, you will immediately see a purple halo around the orders on the right. This means that this block has been edited by this user. We know that that physician signed it. All the orders except the one we canceled have turned white, and the provider's signature has been applied. To get rid of the purple halo, you only need to tap on it. You'll get your green check. It's also important to note that in any block where you can order or administer medications, the allergies will appear in a red box above the order grid or the administration grid. Also in each block, in the right ellipsis, is the ability to add a new block and remove a block that's not a mandatory block. And most importantly, view an audit log. The audit log allows any user to see what changes were made to this block on their behalf or on behalf of Dr. Grant in this instance. You'll also see that I signed many of these orders. And you'll also see that HST, the system, interacted with this block and checked those drugs for you. So even when the system makes a change, it is audit logged for you. And that's a very important feature for HIPAA. All of the block audit logs are rolled up into an audit log report out of the practice management system. As we complete our scroll through, you'll see the consent for surgery. The banner alert in the header will remain there until all required consents have been signed. In this case, we'll have the patient sign, and I will witness. And then we have a handy dandy feature called over the shoulder. If the doctor is walking past the pre-op area, rather than them having to get a tablet or device, log in, navigate to the patient, navigate to their workflow to sign this, they can simply sign it over your shoulder. Once their signature has applied, you'll notice that the consent banner is still here. That is because in this chart, we also have an anesthesia consent. That completion indicator still has a little retweet. You might be curious what other block was affected when the doctor signed those orders. As you can see here, it's telling us it's the medication administration block. It's going to keep track of each of the completed blocks and where you are in your progress. So we'll get there in just a minute. Vital signs, again, are entered via a grid. I'm going to use the room and time, and I'm just going to enter a couple of values here. The values in pre-op are used in the modified Aldrete block to calculate their score. They're also used as part of the Thermia report and can be viewed by any provider at any time. When you complete the vital signs, they will appear in that current visit summary page that we talked about. The pain assessment block is the Wong-Baker faces you are so used to seeing. You can complete all of this or part of it. Again, it will always tell you what's required. There are many blocks in HST chart, about 160 of them. Not all of them will be used by your center. Not all of them are required to complete your charting. However, if there is not a block here and you need it, you can simply add it on the fly. If this patient were a diabetic, I would be able to add on the fly the blood glucose block. It'll add it directly after the block I was just in. It will navigate there for me, and I'll be able to enter the patient's blood sugar. That information will appear anywhere the blood glucose block appears. It will also appear in the in-house lab test results block, which is often located in the anesthesia workflow. The in-house lab tests can also include things like your urine pregnancy test and your INRs, if you do them at your surgery center. We have several blocks that are called clinical decision support. They require an assessment. When you tap on it and complete this assessment, it will give you a score for the patient. In this case, I gave the patient a very high score, and you'll see up in the header, we now have a fall risk alert banner. And you'll have to pick the therapeutic interventions that you're going to use for this patient. The DVT assessment works very similar. It's based on the Cabrini scale, and it will assign the risk for you. You might ask me, why does it already have a 3? Because it already knows the BMI and the age of the patient. IV insertion block, we have a report in practice management that you can use that will pull the data from the IV insertion report, and it will populate a QAPI report for you to see if any of your staff might need assistance or further education when starting an IV. We also have a block called Sketchpad. In this case, I'm using it for IV placement. I'll be able to write on here where the IV was inserted. If I missed the IV several times, I'll be able to say I missed it here, I missed it here. So in PACU, when they see this, they'll be able to check the bandages and make sure that that site is still in good shape. Medication administration block. Once a medication is signed, it will populate the MAR. The user can administer this medication by selecting it and administer selected. They can tap the edit pencil and administer the medication inside of the flyout. They can get another user to confirm the dose of that medication when they draw it up. Every center has medications that they require a second confirmation. This is how you would do that. The other user can tap on, and very much like over the shoulder, they can sign that they witnessed for you and confirmed the dose against the order. We're just going to go ahead and administer it by tapping it. It's going to put that medication in for us. Here is the pre-op surgical safety checklist. This will be designed by you at your center with your words. The next block is patient status. When you give the patient a status of ready, it will show up on the patient locator as the patient being ready. There are other statuses too that you get to create. For example, it might be ready for the physician or ready for anesthesia to block or ready for the surgeon to mark. You get to create what those other statuses might be. I'm going to go ahead and pin this workflow. And I'm going to go back to the schedule screen and the patient locator so that you can see now Mr. Pinello has arrived in pre-op 15 minutes ago. I am the nurse in charge and the patient has a ready status. They still need that H&P attestation signed. But as you can see by the bottom, I am able to quite easily toggle back to the workflow I was in, to the block I was last completing. Supplies used. Every chart depends on the preference card to pull in the correct chart, to pull in the physician orders, and to pull in the supplies for each case. The supplies populate here for ease of documentation. They are not part of the legal chart, but are here so that once confirmed, this information will deplete inventory automatically. In eChart, pre-op can leave the room out blank. This will populate by the OR room in time. You can turn off that feature if you don't care for it, but very often the pre-op nurse may not be aware that the intra-op nurse has taken their patient and moved them into the OR. So this will populate automatically. The room in and the room out and the designated staff populate the staff block. So when the room out is populated by the next workflow's room in, it will also populate the out time here. Let's go to intra-op, cover a few other great features. I'm going to review those allergies. I'm going to see that I have a signed consent, but I still have 2 hard stop red alerts. Those hard stop alerts are because and they will block you from putting in a room in time. One is for that anesthesia consent that we discussed, and the other one is the H&P attestation not signed. You can override these by tapping the Me button. However, be aware, there is a report in practice management that shows every time one of these have been overridden. If your physician hasn't signed the attestation, you can ask them to go ahead and sign it, which I just did. And as you can see, the red warning went away for the H&P attestation, and I got my purple halo. If the anesthesia provider also goes into their workflow and signs that patient's consent, you will see that one disappear as well. So I'm just going to go ahead and do that quickly. And you will see that that has gone as well. And you'll notice in the header that the consent alert has now disappeared. So I am able to freely enter a room in time. Built in the background is also a late start feature that can be turned on and off should you decide you'd like to do a late start based on QAPI. So we're going to blame this on the NPO status. And we're going to go ahead and say that the patient arrived on stretcher into the operating room. Once the OR has entered a room in time, it will activate a feature in eChart called Quick Chart. When you tap on Quick Chart, you can apply a template you have already created that will automatically fill in all of the fields that remain the same for every single sinus patient that you're doing in this room today. The audit log will attribute these blocks' completeness to the receiving staff, to the one who tapped the quick chart. So you can see it already positions the patient for me. It used the positioning aid. It completed the wound classification. It did not complete the surgical safety checklist. The surgical checklist must be completed as it is a patient-specific block. The same is true for timeout. If you don't like the block that HST has designed for timeout, you will be able to create your own block for timeout. We have a fire risk assessment that the system completed because this is a block that will stay the same for all sinus cases because all of the screening is the same for those. If you have a prep for your sinus surgery, you would build it in the preference card. It will automatically populate. But we're not going to prep for this today. And we're going to have an incision start. If the anesthesia team marks incision start at your surgery center, this block can be in their workflow as well. We have the physician orders for the OR, medication administration for the OR, and I'm sure that you will have some at your surgery center. I just did not build any today, but it filled in for me the equipment tower and the serial number of that tower from the quick chart. It also filled in the cautery information from the quick chart. And it pulled in the solutions from the quick chart. I'm going to show you that if you edit these solutions, let's just say we're going to give 8 of them. It was 1 and I've changed it to 8. That's going to be important here in a minute. The specimens that are recorded here are going to populate the operative report. And we're going to see if it has an ethmoid sinus. It does. And we're going to do it's from the left. It was sent to the lab for pathology. And it was sent for, let's just see. I'm going to see where I can find the CNS. Yep, culture and sensitivity. And I'm going to save that. So now I have a specimen that was sent for pathology and culture and sensitivity. If we implant that nasal stent that the rep brought, this is where you should put it. It may not be in your inventory. You could search for it, but if it's not in your inventory, you can still put it in. Put in the manufacturer, catalog number, an item code if you have it, a unique identifier, the size, the quantity, where it was put, and save it. This information for the implant log goes to the operative report as well. It also populates the implant log in the practice management side. You'll be able to use that if you have any recalls, if you need it for billing purposes, and any other implant log use tracking and analytics that you might want to do. Diagnosis information comes directly from practice management, as does the procedure, and you can perform it. If he did more than the functional endoscopic and the ethmoid, you can edit this with the edit pencil. You can add a secondary procedure. All of that will populate back to practice management. It will also populate the operative report. Then you have incision stop, the dressings, which was populated by the quick chart that we used. And then we have supplies used. And you'll notice the normal saline that I changed to 8 is populated as 8. So you don't have to come down to supplies used and re-document any of the changes. You just need to come down here and confirm those supplies. Any supply that has a 0 will not be confirmed. If you decide, you know what, I used another one of these, you are able to clone that, add another one, and confirm again. It will not resend the ones you've already confirmed. It will only send the one that you did. And again, you can complete room out, or you can let the PACU room in complete that for you. However you decide to run your center is fine. I'm going to cover anesthesia quickly, but please note there is an entire workflow review for anesthesia, should your team decide they would like to look at that. The documents are here, and they can be accessed by tapping the hyperlink, which will open it in a new window, as we have seen the same with the previous visit, and you could toggle back and forth. The medications are here as well. The anesthesia history that we completed in the pre-op phone call is here for the anesthesia provider to view. The allergy block also here. The NPO status, had we filled that out, would have also been here. There's those in-house lab results. The COVID test result was negative, and the blood glucose that we did was 90. So the anesthesia provider is able to review that. The system is letting me review everything because I have permissions to do that. Every block and every signature field in eChart is permission-based, so you're able to set that up how you want to. The anesthesia pre-op history and physical meets the requirements of CMS and your accrediting agencies. The anesthesia consent, which I signed in the other, while you weren't looking, in the other login. Here are the anesthesia orders. Again, they can be changed on the fly if you need to change them. They can select them and sign them. Since I'm not an anesthesia provider, I'm going to require it to be over the shoulder. And you'll see that the anesthesiologist has signed the orders. We also allow you to have something called hidden orders. A lot of times anesthesia providers have a secondary and a tertiary pain or nausea agent that they might want you to give, and they have protocols designed for that. They're able to show those additional medications should they need to and add those in. So they would be able to sign one more and then hide the ones they did not want to use. We also have the ability in eChart for you to designate high alert medications, and there's a field for you to create those. They will show up in the chart always in red and in italics and bold. You get to design that. We will teach you how. Anesthesia start time, supervising provider. We're going to put in the anesthesiologist here, and he does not have a supervisor. If you're in a state that requires a supervisor, this field will show here for you. If you're not, this will not appear in the anesthesia start time. You also have the administration of prophylactic antibiotics and a report that tells you if it was given in a timely manner. It will compare this with the anesthesia, with the incision start and or the tourniquet start time. Anesthesia care, the information that they will check and put on the patient. The position comes from the circulator, the airway induction, and the anesthesia graph. The graph allows the surgeon to select, if they want, their own gases that they would like to have show in the front. They can even put them in a specific order, and they will show up in the table. You can construct the table with the medications prior to and have it populate upon creation of the chart. But I wanted to show you the ability that we have to manage medications much the same way. So you could put your fentanyl, your lidocaine, your midazolam, your propofol bolus, your propofol infusion, and any other medications that your doctor wants to have. You can put them in whatever order you want, and they will appear here to be easily added to. We even give you a way to add medications as a set, and each anesthesia provider may have their own induction set that they'd like to use that you could administer. Once you administer those meds, we will total those for you in the right column. Any meds that are given will show up on that current visit summary page that we saw at the beginning. Intake and output that's populated on the table in eChart in anesthesia workflow will automatically populate the intake and output block. So you no longer have to chase an anesthesia provider down to say, how much fluids did you give? And you'll see that the intravenous is already selected, and I can just put and save it. You will see it totals over here, and those totals are brought into the intake output block in PACU. Vital signs can come in via an interface, or the user can drag and drop those vital signs directly into the chart, and it will record and it will trend those. You will see it will give you the exact value, and it gives you that yellow triangle until you put in the other one that goes with it. And we will see that it will go ahead and trend these values for you as you move through. The green line is always the now time. You can also add a note anytime you needed to. And there you have it. When you hover over it, it will tell you what that note says. All of the information that's drag and dropped into the above graph and all of the information in the tables above the graph are also in grids below. And that's for analytics and for information. So you'll be able to see the gases, the medications that were given, any infusions, the vital signs that were taken, the intake and output, and the anesthesia event that we put in. All your providers are able to tap to sign. Incision start time, as you can see, was populated from the OR, and incision stop also from that intra-op workflow. The anesthesia post-op assessment is here, their stop time. They can even view the PACU vitals directly from their workflow and not have to navigate away to see those. The staff block will populate automatically for them. There's the supplies used, which in this case were just the medications that we gave, and anesthesia can confirm those as well. As I said, if your center does not make anesthesia track their supplies, this block would not be in their workflow. We're going to give a quick look at PACU. PACU has one unique block that's very important. Room in time. Again, we're just going to put the patient in our area of care. They came us by stretcher. You have your post-anesthesia airway. These are things you would expect to see. We're going to put them on 6 liters of oxygen by nasal cannula. Breath sounds are clear. They can cough and deep breathe, and we're not going to do that instead of spirometer, and we're going to save that. The next is the vital signs. Again, if you don't have them pulling in by interface, I'm going to go ahead and put in a blood pressure and a heart rate, respirations, and temperature. The pain assessment, you can see what the pre-op pain level was, 0, and maybe now the patient has a bit of a headache and they're at a 4, and it's a sharp headache, but they don't need any medication for it right now. And you have your post-anesthesia recovery score. So The information that you gathered in the above, if you use the modified Aldrete, will populate the modified Aldrete. The post-anesthesia recovery score is another option that you could use similar to modified Aldrete, only it does contain the nausea and vomiting information, and some ambulatory surgery centers prefer the post-anesthesia recovery score to the modified Aldrete. But if you had the modified Aldrete in your workflow, and we're just going to go ahead and pop it in here real quick so that you can see this little fancy schmancy trick. It allows you to enter, I'm going to do it now, but I want you to use all of the values that I already populated in the blocks above. So it's going to do if you had an extremity check block, it would have extremities. Respirations, it pulled that in from my airway block. Circulation, it automatically compared the blood pressure from the pre-op area to the PACU that I entered, and it's going to give me a number. Conscious sedation, you have to fill out. And oxygen saturation, if I said that the patient was on O2, it was going to fill that out for me from vital signs. Now, if your modified Aldrete score stays the same, you don't have to continue to enter all of those fields manually. You can clone it by simply tapping it, cloning it, and putting in the new time and saving it. It will save those values for you a second time. As the patient begins to wake up and you want to change that 1 to a 2, they're fully awake now, you're able to also do that as well and put in the new time. So you're able to do that very, very quickly in each heart. You can assess the dressing, or in this case, the drip gauze that's under the nose. There's your physician orders, your discharge, your PACU, your pain. And you can show hidden orders if you need to as well. The anesthesia orders are here as well. You can see that they've not signed the discharge order yet. That is true for many centers that don't have anesthesia. Sign the discharge order until the patient is actually ready for discharge. The medication administrations are here. You can see that one is PRN. You can have any of those PRN that you want. If you're not going to give the medication, you can delete them from your medication MAR and not give them. Here's that intake and output, and you can see that the anesthesia time's already populated, so that's great. A bedside visit, if anesthesia or the provider come by to visit the patient and they want some notes, they're absolutely able to do that on the fly. You can discontinue that IV. Discharge instructions are created when the chart is opened based on the surgeon and the procedure. So in this case, it's pulling in the general instructions from the center, the ENT instructions, and the general anesthesia instructions. You can edit those on the fly if you need to, directly in the chart. And you can add any instructions that were not given previously. You can review those with the patient. You can have the patient or their significant other sign on the dotted line that they understood all of those. And then you can print them and hand them off to the patient. You can create a print set for discharge that would include discharge instructions and maybe their medication reconciliation block, and maybe also their return of valuables. So the medication reconciliation block would be filled in by your provider and signed off on, and then you would be good to go. You have the discharge plan block, the discharge status block. Home to self-care is the default. If you pick another one, it will change, and it will also create a change in the quality indicators. There's a report that will track any transfers that did not go home or to self-care, and that is how we will track that in the chart. So I'm just going to say we took this patient out by wheelchair in care of his wife, and then you see the quality indicators. So did the patient have a fall, a burn, a wrong site, a wrong procedure, a wrong implant? If the answer is no, then it's going to say they did not have any of those things or a hospital transfer. So it's going to include that for you, even though you didn't fill it out in this block. It's going to take what you filled out in that previous block and apply it to the quality indicators. If you said yes here, you could pick which one it was, and it will change what it shows down here, and it will change the report over in practice management. We're going to go with no. And then, of course, it has your staff and your supplies used. We're going to do a really quick view of the physician workflow. You can see that they have the documents, so they can look at that H&P. They have their orders. They have their H&P attestation, which I signed before and you didn't get to look at. It will pull in that H&P data, and it will say that they've examined the patient and there are no changes, and that the patient is approved for surgery. The procedure consent would also be in the physician's workflow where he signed it. Even though he signed it over our shoulder, he could sign it in his workflow if he wanted. There's that medication reconciliation that the provider would sign down here. Since I'm not the provider, I'm going to go ahead and sign, let him sign over my shoulder. Interim op report. If the surgeon has a dictated report on the chart prior to the patient leaving the OR, they will not need to complete the interim operative report. However, if they're going to dictate the report later, you will need them to complete this, but the information will fill in automatically for them. So the information that the circulator completed, the information that the anesthesia provider entered as an EBL, any specimens here, any implants will show up here. And then this is checked for them. However, if they want to add a note here, they are absolutely able to do so. And then they would just sign that interim op report. In the operative report, there are a couple of choices. They can, all of the information again will pull in automatically for them, including the implants and the specimens. If they dictate, a document will be linked to this block and it will complete automatically after the fact. If they decide they want to use a template, they can create an operative report template where they could just edit certain fields for each procedure, and that is certainly allowable. They can also use voice recognition software should they own a license to that, like Dragon Dictation, and dictate directly into this block and then sign it. If you sent out labs like we did in this case, your chart will be designed to have a lab path results block. The lab path results block will show up as missing results until the results are matched and brought into eChart. So they have missing results, but once that result comes back and is matched to eChart, it will generate a task for the user to go back in and review those. So we're going to talk about tasks here in just a minute. As you can see, there's also a post-op communication, which mimics the pre-op that we looked at. It has your log, your patient information, and all of the questions that you want to ask that patient in post-op. But let's talk about the task manager. If you're a provider, if you have not completed your charts, every night, the system will go through all of the charts, find any required fields that have not been completed, and it will create a task for you to complete. When you tap on that incomplete workflow, it will bring you to the workflow, to the patient, to the block that is missing the information. Once you complete it and go back to your task manager, the task will drop off the list. Now I have a lot of tasks here, but that's because I don't usually clean up my demo charts after I'm done. But if you are an administrator or a medical records administrator, you will have the ability to view everyone's tasks. If you do not have a task, you will get a trophy. But if you forgot one or two things, you might have one or two tasks that are assigned to you that you have to work through. There are reports that can be generated directly from this. As you can see, Robert's case is now complete. He's turned gray because we discharged him. And if I want to, I can delete his pin from the bottom. And this was a previous chart. I might want to go in and make sure that I've completed everything that I needed to complete on Jane before I knocked her off my pin list as well. This concludes the review of a sinus case in HST chart. I hope you found it helpful.